Various terminologies which we use. So as you can appreciate, this is the mandible and these are the teeth. So this part of the teeth which is towards the midline, towards the anterior side, this is the mesial part. This part which is posterior, away from the midline, that is the distal part. The part which is facing the buccal mucosa, outside this way, this is the buccal part, and this part which is towards the tongue is the lingual part. So mesial, distal, buccal and lingual, and this is the surface of the teeth which is going to come in contact with the surface of the maxillary teeth. It is the occlusal surface. So now that we have seen the various terminologies which have been used for the angle classification, we'll actually see how it is classified. Please excuse my diagrams. These are just for the purpose of easier understanding of this classification. So Edward Engel has proposed this classification of occlusion, or we can call it as malocclusion. Now with respect to these images, these blue things, these blue molars are the maxillary molars, and the black molars are the mandibular molars. So these are all the first molars. This is the mesial side, this is the distal side. Again, mesial is towards the midline, towards the symphysis menti. Distal is towards the condyle ramus. So that part of the mandible is distal, that is mesial. So occlusion is defined in terms of the mesiobuccal cusp. So this is the mesiobuccal cusp. Imagine that you are seeing this image through the cheek. So it is a two-dimensional image. The mesiobuccal cusp of the upper first molar, of the maxillary first molar, occludes with the mesiobuccal groove of the mandibular first molar. So this is class 1 occlusion. This is, we can also call it as normal. Mesiobuccal cusp of upper first molar occludes with the mesiobuccal groove of the lower first molar, of the mandibular first molar. Now this is class 1. Coming to class 2. Again, this is the mesiobuccal cusp. The mesiobuccal cusp of the maxillary first molar is mesial. It is mesial to the mandibular first molar. So the maxilla is mesial, mandible is distal, or rather the maxilla is protruded, the mandible is retruded. So this is class 2 classification. It is also called as retrognathia. Now coming to class 3 classification. Again we are talking in terms of the mesiobuccal cusp of the upper first molar, mesiobuccal cusp of the upper first molar in relation to the mandibular first molar. This is distal. So this was mesial. So mesiobuccal cusp of the maxillary first molar is distal to the mesiobuccal groove, or the you can say the mandibular first molar. So in this case, the mandibular is prognathic, maxilla is retruded. So this is class 3, which can also be called as prognathia. So this is in brief about the angle classification. It was proposed by Edward Engel. Thank you.